we'll just wait a few minutes for so that people can join us. Can you see it? C'est sur le YouTube de IFMSA. Okay. We're just making sure that we can see the live video on the YouTube channel of IFMSA-Québec. Je suis sur YouTube, mais qu'est-ce que tu cherches? Genre, attends.
Live now, 6 watching.
Ah, ça marche?
Ok, c'est bon.
Oui.
Je pense que c'est bon. Ok.
Est-ce qu'on voit ceux qui watch? Non?
C'est où?
On est 109. Il y a un délai de comme peut-être 30 secondes.
Ok, on commence.
Oui. Il y a 12 personnes. Je sais pas si vous voulez attendre qu'il y en ait plus.
Ouais. We'll just wait like a minute or two.
Et il y en a quand même 12.
Ouais.
Il y en a 12. Je sais pas si nous on compte.
C'est rendu à combien?
10. Une pause pour dire que ça commence. Sur la page Facebook.
Puis là, je peux seulement mettre un lien YouTube.
Le lien est déjà là.
Dans la description de l'événement.
Elle demande le link pour YouTube.
C'est sur la page Facebook.
Je pense que c'est comme quelqu'un doit le poster.
Il est là, right?
Ouais.
On le repost.
Mais j'essaye de le voir, mais je ne vois pas.
Ok, mais sinon, je vais juste aller directement.
Ah, ok, c'est bon. Okay. Mais je pense qu'on peut commencer.
Ouais, mais je vais juste faire un post pour vous. Avec le
pour
lien.
dire que chaque
Is beginning or starting?
Is live now.
C'est bon, ça is live now. C'est où qu'on voit combien de personnes sur YouTube? Ah, 9 spectateurs. Ah, ok. Okay. Should we go?
Yes.
Okay. So, hello everyone, and welcome to this webinar on how to make your hospitals greener. As the title explains it, we will be discussing what we can do as medical students to advocate for a more eco-friendly work environment on a scale that ranges from our communities to the international level.
This webinar is organized by IFMSA-Québec, and it's a new project exclusively created by medical students from all over the world. To introduce ourselves, I am Julie. I am the National Assistant for Capacity Building. And this is Florence. She is the Green Coordinator.
Yeah, for IFMSA-Québec. So as the position I occupy this year is it's Green Coordinator, and it's a new one in IFMSA-Québec. That's why I want to talk to you a little bit about it. It was created a year ago, and because IFMSA-Québec wanted a position specifically dedicated to make sure that all of our events are as eco-friendly as possible, and that we promote throughout the year sustainable development, even in the medical field. So just to give you examples of what we can do, this year I'm on the organizing committee of every event that take place in Quebec, in our province of Quebec, just to make sure that we are as eco-friendly as possible, as I said, and like by buying food that is local or vegetarian all the time, and to also to organize carpooling to our events. I can also I will organize this year sessions of clothing exchange between the medical students, and also I want to make sure that every campus in Quebec has their compost system. So these are just some examples of activities that I will do this year, and we encourage all of the NMOs to have a green coordinator. I will be available if you want to ask a question at the end of the webinar, so you can create your own green coordinator in your NMO. So,
okay. So we want to thank all of the amazing speakers that you will hear today. We have Cyril from IFMSA-Grenada, Catalina from Chile, Omnia from Egypt, and Roxanne from Quebec. So I will let each speaker present yourself. So we have Cyril first.
Hi, everyone. Nice to see you guys. Thank you, Julie. Thank you, Florence, for hosting, and IFMSA-Québec as well. Thank you so much for hosting an amazing webinar. My name is Cyril Patra. I am a second-year medical student here in Grenada and here at St. George's University. And today I'll be talking about climate change and health and why medical students should care.
Perfect.
Thank you. Catalina?
Hello, everyone. Thank you, girls, for the invitation. My name is Catalina González. I am now serving as Gov-RA for the Americas, and I am also MPO for IFMSA-Chile. And today I'll be talking about the impact of hospitals in the environment and what can we as medical students do, of course, from IFMSA, and why is it important for us to act. Thank you.
Perfect. Thank you. Omnia?
Yes, hi everyone. Thank you, girls, and thank you, IFMSA-Québec, for the wonderful webinar and this opportunity for your members. I'm Omnia Omrani. I'm the IFMSA Liaison Officer for Public Health Issues, and I'm here to talk to you about the external processes that happen in IFMSA related to climate change advocacy, as well as I would love to also introduce the idea of the health, not just the health impacts, but also the health co-benefits and opportunities offered by climate change, and finally how you can be involved in the external processes of climate change for the most advocacy achievable.
Thank you, Omnia. We'll let Roxanne present herself.
Yes, so hi everyone, I'm Roxanne St-Pierre-alain. Okay, so sorry, I'm Roxanne St-Pierre-alain. I'm the current program coordinator on environment and health for IFMSA, and I'm a former IFMSA-Quebec president, so I'm really glad that IFMSA-Quebec is hosting this webinar. So today I will be talking about how to make things concrete. So with all of those beautiful presentations just before me, I will maybe help you a little bit to make that thing a reality and to make that idea a good impact. So that would be it for my presentation.
Couldn't have found a better timing because, as you may know, tomorrow begins the 25th United Nations Climate Change Conference. It will be held in Madrid, but Chile is organizing and preside the conference. And so during the next 2 weeks, for those who are not familiar with the COP25, during the next 2 weeks, a lot of hundreds, in fact, of world leaders will meet in Madrid and discuss about measures to take to stop global warming. So their slogan for this year is as simple as time for actions. So let's just hope that they stand up to that. So on this, I'll let our first speaker begin. So Cyril, you can talk to us.
So, alrighty, guys. So I'll go ahead and start talking about the reason for why medical students should care. So I'm going to go a little bit, just some details about like what climate change is first. So here's my objectives. So we'll talk a little bit about what climate change is, what's the big deal, consequences of climate change as well. A clip of, sorry, move this back. Okay, a clip. Well, probably won't do the clip just in case at a time, but a little bit like global, local, of what happens in Grenada, climate change and health threats, and again at the end, how can medical students respond? All right. So a little bit about what climate change is. So why do people care so much about this, right? So I looked up online about what the CDC says. So it says the major decadal changes in the Earth's temperature, rainfall, snow, wind patterns. This is predominantly man-made, consequently from the release of greenhouse gases, burning of fossil fuels, using energy to drive, electricity to light our homes, heat, things like that. All of these greenhouse gases are then going to be trapped in the atmosphere, which then ends up increasing our temperature. And then because of that, it ends up having a lot of different consequences, such as glaciers are starting to melt, different types of bacteria that were preserved in a lot of these glaciers are now impacting the ocean life. We have rainwater and flooding occurring all over that are impacting various farming and agriculture around the world, all that we really depend on. This ends up making a huge impact. And it ends up making an impact on people's health. It ends up making an impact on community, water resources, again, agriculture. So people's lifestyles are being impacted, forestry, wildlife, and energy supply as well. So essentially, climate change, the climate is changing. We know that. We have evidence of that. And there are very big detrimental consequences of this change. And that way, because of that, it's going to affect the people around us, the people that we care about, our family, our future patients, and our community as well. All right. So a little bit more of consequences of climate change. So all of this information I actually pulled from our IFMSA manual from SCORP, which is the Standing Committee of Human Rights and Peace. And so the information they'll talk about that were highlighted in it were natural systems. So how does climate change affect that? Well, it's going to affect our freshwater sources. This is important because obviously people need to drink water. Our body is made of water, of course. We all know that. It's important for hygiene. It's important for sanitation, again, agriculture, and of course, energy production as well. Another big impact is food security and food production systems. A lot of our crops are wheat, rice, maize. They'll be impacted because the environment or the locations such as in tropical and temperate environments may not be getting will be getting maybe too much water or flooding, and that's going to be affecting these crops that are food sources for us and also economical sources for people. We also have climate change that's going to be affecting our seafood, so fish and freshwater and marine species as well. And again, all of that is this delicate balance that we have in our ecosystem. When that's disrupted, it disrupts our health as well. Of course, access to food security across the world will be limited too. So of course, without food, can't really survive, right? So we need that energy. So climate change can affect that, and it's going to cause a really impoverished, or sorry, not impoverished, but like the food inadequacy is going to be affecting our health as well. It also affects migration. I found that pretty interesting as well, because I wasn't really thinking too much about this at first. But then when I read about that, I was like, wow, like that's a pretty important topic as well. When we think about climate change, I think we usually think of like vectors or communicable diseases and things, but that's does affect migration as well, as we see people are constantly moving as well, and developing countries specifically will be affected. Of course, our economy, I already kind of talked a little bit about that when we talked about the agricultural aspect of it, but it does affect the social aspect of the communities, environmental, institutional, economic capital, because of extreme weather events that go into flooding, famine, cyclones. All of this is going to affect the entire country's health, infrastructure, and productivity. A 2-degree increase, like I said in here, can impact almost 0.2 to 2% of our global annual domestic product or GDP, and that's all of us in by the mid-century. It can also affect our economical sectors, such as water, electricity, transport, tourism, insurance, and health. And we kind of think about those topics, these are all parts of our daily lives. And then finally, it also affects poverty. People who are in developing countries or in areas where they don't have access to healthcare or clean water are going to be the people who are going to be most impacted. And that's a large percentage of people. A lot of these people are going to be losing their jobs because their crop yields are going to be low, or they won't have or their homes may be destroyed, and they'll have food insecurity, we talked about. And so because of it, the poor, the people who are in poverty are going to be most impacted due to the effects of climate change. So that's why it's really important to think about what are these consequences of climate change and better prepare ourselves to think about how we're going to be moving forward in each of our different countries and hospitals, looking out for people who are directly affected by this. So again, IFMSA is known for think global and act local. So I'm sitting here in Grenada, and which is an island in the West Indies. I'm going to share this link with you guys. I won't have time probably to play it, but if you guys are interested, I can share that with you guys to learn a little bit about how Grenada is tackling climate change issues here, which is a big part of this island. So now kind of circling back to the health aspect of it again, because we're medical students and of course that's like our big goal is to help people in their health. So again, climate change here is the biggest global health threat of the 21st century. It's going to be affecting our health, and it's going to exacerbate inequities between the rich and poor, and that was quoted by the Lancet. Of course, heat waves in various systems now, of course. We'll look about heat waves, how it affects us. It looks at incidence of heat strokes. So we have higher incidences of heat strokes. We see more people who are getting dehydrated. This can eventually lead to kidney disease. We have heat-related deaths as well. And these extreme temperature events can, of course, then affect our cardiovascular diseases as well. So you start to see people who have reduced cardiovascular reserves. We have respiratory diseases that are rising. We have infectious and intestinal vector-borne diseases, and of course, hyperthermia as well. So these are the types of symptoms and diseases that we want to look out for when we start to see patients. And again, in other ways, sea level rising can affect our environment in terms of biodiversity, because we'll now start seeing the loss of biodiversity. We're going to be seeing a change in distribution, replication. We're going to see more vectors. Like I said earlier, while the glaciers are melting now, we all of a sudden are seeing emergence of bacterial life that were preserved in the ice are now affecting a lot of the sea animals. We have foodborne infections. We have ozone increases affecting ecosystems, collapsing, habitation, poverty, and then mass migration will be affected. A lot of these changes are then going to eventually lead to crop failure, which then will affect vector-borne, again, non-communicable diseases, and also increase our asthma, allergies, COPD, and cardiovascular diseases. So you can see climate change is actually affecting a lot of people's entire system in some ways, and in a lot of the big systems that we already see that in when we see patients in the hospitals, but in community clinics. But now we're going to be seeing more of it. So there's going to be a rise in a lot of the incidence of these diseases. So it'll be more important for us as medical students to start asking questions about what is going on in the homes, what is going on in the people around you, what is your job, like all these occupational jobs. All those important questions that we ask about the quality of life in general are going to be really, really important for us to start inquiring about that when we start talking to our patients, because that is going to be a big part of how we can take care of our patients in the best way possible. So some more climate change, of course, is going. Mental health, this one's a huge one. This one is really important because we start to see people again that are migrating. We have displaced populations. We see social and violent conflict arising from climate change, migration, displacement. So people are losing their homes when it comes to devastating like cyclones and hurricanes, or maybe just even moving because they just can't produce the same agriculture anymore. This is causing a lot of issues on people's mental health. They're losing their livelihoods. And I think that's really important to think about as we become physicians, because that's our whole job, is to help people improve their livelihoods with their health. And these people who are being displaced don't have that same or having decreased livelihoods because of it. And I don't know, that just really like struck out to me, and I thought that was very important to start to think about again when we start to see our patients. And of course, again, like a lot of people who are being moved around because of it, or have mental health issues because of it, are being put into labor conditions that maybe that are really bad conditions for them, including physical and sexual abuse. Of course, not having that lack of access to mental health and legal services, of course, is a huge human rights violation as well, and that's a part of their mental health that might be decreasing or declining as well. Not having that access to the care that they need. There's that trauma again, loss of home, right? People, if you might lose your own home, how do you feel about that, right? So kind of putting ourselves into that picture of people all over the world who are losing their homes due to climate change, or even imagining the future losing all those homes, is pretty detrimental to our mental health. Also family members living with disability as well. These are really big things. Of course, some of the TSM disorder come that work out physicians looking for depression in patients, looking for generalized anxiety disorder, looking for PTSD, post-traumatic stress disorder as well in these patients. So that's the mental health aspect of it that I think is really important to think about when it comes to climate change, and to of course inquire upon when we see our patients. And then, of course, there's also the air pollutants aspect of it. Our air pollutants are increasing. This is leading to exacerbation of asthma, or COPD, stroke, heart disease, cancer, acute tract respiratory infections as well, and may even affect pregnancies in women and have CNS effects. So after all of this, what can we do as medical students? Well, first and foremost, to educate ourselves. I think that's going to be probably the most important thing that we can do, is to read literature, start to keep up with the latest research, think about how we can work with our attendings, our nurses, our staff in the hospitals. How do we lead as medical students and voice ourselves? I think that's going to be a really big platform for us when we get into the clinical world. Other things that we can do and inspire our family members, our friends, our classmates, using reusable bottles. Pretty easy to do. Coffee mugs instead of paper or styrofoam. You can garden to grow your own vegetables. I think Florence was saying and having more like vegetarian or vegan options, or more plant-based diets would be really helpful as well. Using reusable grocery bags. You can walk wherever you go. I just adjusted campus here, but you can walk to or bike to various places, maybe carpool. I think that was mentioned as well. Supporting local vendors as well. And then, of course, the big is just discussing this, is really voicing what climate change is, us being the advocates of this and what happens in the future. I think we're going to be the people who, as medical students, who need to talk about this, and we can do that with our friends, we can do that with our classmates, we can do that with family and professors, attendings, whoever we want to talk to. I think it's an important conversation to have, and that's a really good way to respond. You can do volunteer beach cleanup. I live on an island, so that's why I suggested beach cleanup. But you can also do park cleanups. You can do your city cleanups, all sorts of things like that. Campus cleanups, meatless Mondays or plant food diet we talked about. Meeting with Congress people, writing an op-ed. So these are a little bit more intense advocacy opportunities, but they are really impactful because at the end of the day, policy is really important, right? So we want to be able to have the confidence by educating ourselves, being activists in this, and being able to go and speak to people who can really make some bigger changes, so we can see that global impact. But these are just some things that we can do as medical students. I'm happy to hear more ideas. I'd love to hear more ideas, and I think the more we work together, the more we voice ourselves, we'll be able to really make some big changes. All right, so this is just the IFMSA position on climate change, and of course the UN's SDG goals as well that we work through. So if you guys have some time to read that, I'd highly recommend it. Other than that, these are the resources that I used. And a conclusion quote by our wonderful Greta Thunberg: "We must do the impossible because giving up can never ever be an option." Alrighty, thank you so much, guys.
Okay, thank you, Cyril, for this good introduction on climate change and its consequences on our planet and on our health. The next speaker is Catalina. She will talk about hospitals more in details. So,
Okay.
Thank you.
Okay. Hello, everyone. So for the ones who are now here with us, my name is Catalina. I am from IFMSA-Chile. I'm the Scoffer for this period. And again, thank you so much for the invitation. And I'll be talking about the impact of hospitals in the environment and our role as medical students in front of this matter, and more in a view of SCOF, like a public health committee. So I hope you enjoy it. I'll be kind of brief with everything. So the outline for this section would be, first I'm going to talk about the context of hospitals' impact on the environment, the relationship of this with health, why is it so important, our role as medical students, what can we actually do about it, of course as an IFMSA view, and examples in the Americas of things that have been done, and that's it about it. So, hospitals' environmental impact. How big is actually the damage we're doing day by day in the hospital? A little bit of context I could find by doing a little bit of research, going through a lot of papers, going through the reports from the World Health Organization. There are actually only 4 countries, according to the World Health Organization, that have done research on this topic, like standardized. There are first 4 of them: the US, Australia, Canada, and England. And the report says that it reports like the percentage of how much of the greenhouse gas emissions corresponds to healthcare sector emissions. So for the US, the biggest one of the 4 of them, 8 to 10%, then Australia with 7%, Canada with 5%, and then we have England with 3.2%. These are the more updated data I could find. And it might sound, I'm sorry, like a little percentage. However, you have to see it like in a big perspective, because for a country, for example, like England, 3.2% corresponds to 18 million tons of CO2 emissions and 30% of the total public sector greenhouse gas emissions. So it is a lot. Of course, since I'm already for the Americas, I try to look out for percentage from my region, and I could only find this one from Brazil. That it says that 10.6% of the country's total energy consumption from the healthcare, it belongs to the healthcare facilities. There's nothing from the greenhouse gas emissions that I could find. Maybe some of you have, but if so, let me know. So this is like the context. Why is it so important? Why should we care and act now, since there are a lot of other industries, a lot of other sectors that are maybe contributing in a bigger percentage to the impact to the environment? Well, we have to think that hospitals belong to the healthcare system. Healthcare system is, its duty is to ensure the health for the people. A conventional healthcare system with a conventional energy use, not sustainable, with its toxic emissions and waste, not recycling, reducing, and everything, is actually actively damaging the population's health. And it's the same population the hospital is receiving as patients. So it's a vicious cycle where the hospital is actually damaging the health of the people they want to help. On the other hand, if we talk about an eco-friendly healthcare system, how it should be, or how we want it to be, if we use sustainable energy, if we correctly manage waste and we reduce the production of waste, we'll be actively reducing the damage to the population's health. And then we will not have new patients or more people sick for our own mistakes, if we want to say it that way. Because a conventional healthcare system is actively damaging the health of the people we want to help. That's why it's so important to realize this problem, to realize it's like how big it is, how much damage we're actually doing. Because it may seem like a 3.2% in England, like the lowest, a 10.6% in Brazil, and 10% in the US. But it's actually a 10% that it's damaging, that it's making people sick from the same healthcare facilities that want them to be healthy. So, according to the World Health Organization, Healthy Hospitals, Planet, Healthy People, a report they did in 2009, there are 7 elements for a climate-friendly hospital. It has to be energy efficient. It has to have a green building design, like for it to don't need that much energy waste to keep it climate. It has to have an alternative energy generation from renewable energy. Transportation has to be also from renewable resources. Food, it should be locally but waste should be managed accordingly, and water. As you might see from your rotations, they usually use bottled water, and that's a lot of bottles and a lot of plastic we use every day, among everything else we use in the hospital. So, as from the same report, I took this quote that says, "The health sector can play a key role in helping societies to adapt to the effects of climate change and the risk it poses to human health." I think it's really according to what I exposed before. So, what's our role as medical, and not just medical, health students in all of this problem? Because as active members of the hospital's team, we're actually contributing to the problem day by day. But it doesn't have to be that way. Being close to the hospitals and healthcare centers, while being aware of this situation, being aware of how much the hospital is contributing to the greenhouse gas emissions, is the perfect start for us to make a change. And some of the other speakers are going to talk more deeply into this. I'm going to talk just about the local initiatives you can do from the IFMSA activities and projects, but there's a lot of things you can do. As here I mentioned, a lot of problems, the bigger the problem, there are lots of options and ideas and solutions you can offer. There are lots of things you can actually do. From my part, I can give you these ideas. To develop activities, to develop projects in your hospitals and healthcare centers. And not just there, but with your own colleagues, with your own partners in the university who go with you to the hospital. There are two things that are more important, and I want you to consider first. The first steps to do this: educational activities and activities to raise awareness. You can't start doing things, you can't start motivating people if they are not aware of the problem, if they don't understand how big the problem is. And also, you cannot do things without knowing, without having the real knowledge of what's behind it, what's the real problem statement. So those are the two things you can do. Educational activities can be talks, can be stands where you talk to people and teach them, and it can be also workshops with your own friends. Everything can be considered an educational activity as soon as you're informing people. On the other side, we have environmental care activities, such as going to actually recycle, to put activities to reduce waste in hospitals, energy consumption reduction campaigns, for example. I don't know, go to the hospital and tell everyone to, okay, this week we're going to try to not use that much energy, to turn off the lights. I don't know, that kind of things can be done. That can be done too on the internet, like online campaigns. That's the kind of things we do in SCAF. That's the kind of things they're easier. They sound really easy to do. They sound really superficial sometimes, but it's really amazing how much impact you can do while doing so. And then another big topic that another speaker is going to touch is advocacy. And those are the big changes. These two things you can do on parallel, but also you have to believe as medical student, that you can actually make the change. You have a voice, and you have to believe in yourself and how much change you can do in the world, because it's real that other people have achieved a lot of amazing things, and if you want it, you can get it. So that's it. And to end here, I show you some examples in the Americas, from Ecuador and one from IFMSA Peru. One is called Operación Tierra, Operation Earth. It aims to reduce the environmental impact of all projects. Now it's a pilot done in SCAF, by creating guidelines on resources management for NPOs and LPOs, and infographic material that they send over email, on social media, and also on every activity they do, they include an environmental impact measurement to see if that project, how eco-friendly that project was. That thanks to my NPO from that country to for sharing that with me. And also there is the project from IFMSA Peru. That's actually a project including the participation of external partners, not just from the NMO, and that's called Concientízate. It's a word game with its campaign Yo Me Comprometo. That's kind of I compromise. That kind of works. Eco, no. And it's a big national campaign with an online promotion of the topic, a series of activities, talks on climate change and health on a lot of universities. So yeah, and thanks to Maria Eugenia from Ecuador and to Jose for sharing that with me. And to end, remember, greener hospitals mean better health for everyone. It is our responsibility because we take part of the problem too. Thank you.
Hi everyone. I apologize for the technical difficulty, but I'm here now. Okay, perfect. Sorry. Oh, okay. So, hi everyone. As I presented myself, I'm Omrani. I'm here to talk to you about advocacy and external processes related to climate change. So first of all, I would love to start with a very interesting photo that I came to, which is, it has been just recently released by the Lancet Countdown Report. And the Lancet Countdown Report is, sorry. So the Lancet Countdown Report, as you all know, that climate change, and as my previous presenters explained the links between climate change and health, the Lancet was the first paper that announced that climate change is one of the biggest global health emergencies of the 21st century, and that was announced by the Lancet Countdown Report. And then every year they update the report with the most recent impacts done by climate change. The Lancet report was released this month, the 2019 version, and basically it announced that climate change impacts most the health of the children, because now climate change shapes the consequences and the impacts of the lives of children at every stage, because it's not just a problem that affects the older generations, but it will affect the future of the current and the future generations. So this photo shows how, as a child, now the struggle of thriving but also surviving, because the basic needs that we are entitled to are endangered by climate change. So what are the countries doing about that? This is a very important question. So basically, let's go into a history trip. So the UN agency that is responsible for all the climate change processes is known as the UNFCCC. And this convention was adopted in 1992 in Rio de Janeiro. So what does this convention aim to provide? So the first goal of this convention is that it binds countries and allows them to limit the greenhouse gas emissions that are produced by their factories and by their hospitals and healthcare centers, as well as companies and so on. So it basically gives them a limit that they should not exceed, so that we can reduce the impacts of climate change as much as possible. The second thing is that the climate change convention aims to is that it organizes and it formulates certain agreements, and these agreements are negotiated between countries so that they can ultimately tackle climate change. So they basically give them guidelines and set of protocols and agreements that they can work on and follow, so that we can ultimately reach net zero carbon emissions. Moving on. So in 2015, it was one of the biggest moments in the history of climate change. Why is that? Because every year countries meet, and this meeting is organized by the UNFCCC, and it is called COP, the climate change, the conference of the parties, which is basically the most and the biggest important climate change negotiation conference that takes place every year for countries to discuss their emissions and their the treaties and the protocols that are designed between the countries, so that they can ultimately reduce the impacts of climate change and take climate action. So there has been a lot of discussions that are happening since Rio de Janeiro, the beginning of the UNFCCC. They are struggling and trying to get countries to agree and to come to an agreement that will be signed by all countries. This only happened in 2015, which is the biggest moment in climate negotiation history. It took place in COP21 in Paris, where finally 125 countries agreed to the Paris Agreement and they signed off on it. The Paris Agreement is a very smart agreement, because at first they had the Kyoto Protocol, which was way before the Paris Agreement, and many countries agreed and signed to it. However, it was very binding and it was not that effective, and countries were not doing by what they committed to. So then the COP21 decided to create another agreement, which is called the Paris Agreement, upon which countries are required to submit their own plans according to their own priorities to the convention, and they will sign off to it. So that these plans that are designed by them and not by the UNFCCC or by any other committee, they are then created by the countries themselves. So it's according to their own needs, according to their own, most importantly, capabilities, that they can work towards reducing the impacts of climate change and reaching net zero carbon emissions. So what are these plans called? They are called the nationally determined contributions. And these are necessary for the countries to strengthen their efforts to take urgent climate action as much as possible. And they are signed off by the countries, and they will start working on 2020. So here's the timeline of the NDCs, and here's how the processes started working out since the beginning of the Paris Agreement. So the rulebook was adopted in Paris in 2018. And then after that, After that, during 2015, when the Paris Agreement was adopted, in 2018, the discussions started. And then we have, in 2019, there was the Secretary General UN Climate Summit, which the purpose of it is that to highlight climate change as a very important UN priority, a global emergency that all countries must act upon it. And this year, as Julie mentioned, that tomorrow will be the opening of the climate change conference, the Conference of the Parties 25, that will take place in Madrid. And I will head the delegation of IFMSA to this conference. And we are going to share with the IFMSA members all the negotiations and what is going on during that conference, as well as IFMSA will be delivering a lot of actions and interventions during the conference. So this COP, which is COP25, is a very critical COP, as well as COP26, because it is the duration between 2019 and 2020, where all the countries are going to submit their final plans, their final NDCs, and then they are going to start on implementing them and working on them. The ultimate goal, as I said, is by 2050, we reach all global countries net zero emissions, which is the ultimate climate resilience. Moving on, what are NDCs? As I explained before, these are the documents, these are the plans that are submitted by the countries to the Paris Agreement, saying that we are going to address climate change, we are going to tackle climate change, we are going to reach net zero climate emissions, carbon emissions, and they are produced according to the individual circumstances and the priorities of each country. Because again, we live in a world where there are developing and there are developed countries, and each of these countries have their own capabilities. Hence, they are going to shape their own plans to tackle climate change. So, how are these NDCs related to us, the health sector? As you all know, we are the medical students, we are the future healthcare professionals, the ones that are responsible for the future health community. And as I was talking about the Lancet Countdown, the Lancet Countdown report, it reported that in 2019, almost more than 50%, which is 51% of global cities, expect climate change to compromise public health infrastructure. That's why climate change is a health emergency. And we, as a health sector, we are accountable, we are responsible for taking action. So, how can health fit in the NDCs? So basically, the NDCs and the plans submitted by the parties and the countries, they present an opportunity for health. They present an opportunity for us as the future health sector and global health workforce to call for governments to make health a central consideration in their work and their plans for climate change. Because again, there are dire health impacts of climate change, and there are also health benefits to all the climate change solutions that countries are doing. So, for example, if countries decide to reduce air pollution, we are reducing the burden of non-communicable diseases, such as respiratory diseases, such as asthma. And countries are promoting active transport. We are then increasing physical exercise, and we are increasing the health of the individual. So there are many health co-benefits to each climate solution that we as a health sector are capable of putting it out there and pushing for climate action through these health co-benefits. In addition, that the health co-benefits, the climate solutions, they cost countries, and hence the health benefits, they offset such costs. So it's another way to lobby in countries and to lobby in health to push for more climate change action. In addition, that we as a health sector, we are endangered by the climate change impacts, but we are also contributing to the emissions and to the emissions that are produced by our hospitals, our healthcare facilities. And we should walk the talk, and we should also reduce our own emissions as a health sector. Finally, the impacts of climate change affect populations in a very disproportionate way. They affect women more than men, and there are gender inequalities and differences between the impacts of climate change. In addition, they are also affecting our generation more than the older generations. Climate change is impacting the health of the child in ways that are increasing every day at every stage of our life. And finally, they are affecting developing countries more than developed countries. So there is a huge intergenerational as well as international injustice caused by climate change. And this is a heat map. It was developed by the World Health Organization that shows how committed the countries are to their plans and to their NDCs to reduce climate change. So as you can see that most countries are not, either they show no commitment or they show an updated commitment. However, it needs to be updated. And then there are certain countries, for example, in Latin America and some countries in Africa, that just need to enhance their commitments. However, the majority of countries show very little commitment to climate change adaptation, mitigation, and climate change solution plans. So, what is IFMSA doing about that? As I just said, we are 1.3 million medical students worldwide. We are present in 128 countries. Our network is unique, is widespread, and is very, very impactful and powerful in all the different global health fields. When it comes to climate change and when it comes to climate change advocacy work, we have our policy statement on climate change and health that was adopted in 2016. We also have our food for health and sustainability policy that was just adopted in 2019 in Taiwan. And this also is very relevant to climate change and planetary health diet. And we also have other policies that can be relevant to climate change, such as NCDs and so on. And as you can see in the second photo, we have our delegation to COP24, which was last year in Poland. And this is what we do. For years, IFMSA has been sending delegations to COP. And these delegations, they are a group of passionate health advocates from IFMSA. They are IFMSA members that are advocating for climate change and health, either through the youth constituency, which is part of the UNFCCC, and also through the health sector, such as the Global Climate and Health Alliance. When we go to COPs, we use policy briefs. And for this COP, we are going to have 4 different policy briefs on climate change and health, on gender and climate change, and how gender health is disproportionately impacted by climate change, as well as food for health and sustainability. And finally, as I will talk about furthermore, climate change in the medical clinic. And this is a photo of an action that we did last year in the COP venue, where we tried to show the leaders of the negotiators, the decisions, the climate change health impacts is up to you, and the health of our current and future generations is in your hand. So it's time for you to tackle climate change and to take urgent action to treat climate change as an emergency that we must all act upon now, all sectors of the community included. These are the different tools that IFMSA has developed over the years. We have the IFMSA recommendations for sustainable and meetings, and this was executed perfectly by many GAs, including the GA that took place in Montreal, and it was 100% sustainable. So this is one of the highlights that we are super proud of as IFMSA. And we also worked with the World Health Organization. Actually, Claudel, one of the most remarkable climate and change and health advocates was the one who worked on it with the previous LPH standard. And this training manual is available for medical students to do their own advocacy activity and capacity building workshops on climate change and health. Finally, we developed a toolkit on public health in the medical curriculum, which is why we are going to highlight this even more when we're talking about the IFMSA health vision. What can you do about it? So, first of all, what is the role of medical students in climate change external advocacy? So first, we as medical students, we are very capable of advocating both the health impact and the health co-benefits of climate change. We have an active role and a strong voice to integrate climate change in our own curriculum. Why? To pave the way for a climate resilient health sector, for a climate resilient society, for climate resilient health professionals who know how to work with climate change impacts, health impacts, as well as on the community itself. And not just within the curriculum, but also within the extracurricular activities that we conduct. Finally, we as medical students, future healthcare professionals, we call for sustainable and climate resilient universities, healthcare facilities, and health systems which follow WHO operational framework and guidelines, the same as what we do for our general assemblies and our own meetings in IFMSA. And finally, I would love to conclude with the IFMSA 2020 Climate Health Vision. And this vision aims to have an element of climate health in the curriculum of the medical curriculum of every medical school by 2020. And also, we are working towards accomplishing this vision now, which has also been implemented already by IFMSA-Canada, CFMS-Canada, and also the vision aims to integrate climate health not just in the curriculum, but in all aspects of medical school life, including research, advocacy, training, and university healthcare systems by 2025. So this is the ultimate goal. This is the vision that we as IFMSA are working towards. How are we doing that? So we developed the Climate and Health Training Manual, as I mentioned before. We have our Public Health in the Medical Curriculum Toolkit that is designed for medical students to use and to try to advocate with their universities to improve public health knowledge in the toolkit. We opened a small working group that is going to work on developing climate change core competencies that are suitable for the medical education framework to include climate change in the curriculum. And finally, we are going to create a climate health map on the IFMSA website that shows the situation of climate change in the medical curriculum in all countries of IFMSA. Finally, I would love to conclude that to achieve health for all, we need to act on climate change. And please follow IFMSA, Instagram, Facebook, as well as the Twitter account in the upcoming 2 weeks, because we are going to be there in the climate change conference in Madrid. We are going to do interventions, take action, as well as advocate for health in the climate change negotiations, and also advocate for the powerful voice of youth, representing your stances in all the discussions that are going to take place. So please follow us, and we're looking forward to your feedback. And if you have any questions, please don't hesitate to email me at lph@ifmsa.org. Thank you.
Thank you, Omnia. It was a very interesting talk about external processes and health co-benefits. I would just like to add, as National Assistant for Capacity Building, that I think it's very important for medical students to have access to resources and trainings on the subject of environment and health. And I hope this webinar will be useful for you in that matter. Finally, we have our last speaker, last but not least speaker, Roxanne. She will give us concrete tips on how to implement change in hospitals.
Okay, so hi everyone, just making it full screen. So yeah, so the talk for my part will be how to make things concrete. So little steps and helps to really make a change in your hospitals. I will be touching some things that were previously said by my others in this webinar, but it's really to make sure that you can take all of those information and make something about it. So first thing, how to who to talk to if you want to do some change. So there's a lot of things going on in the hospital. If you have ever been in the rounds, you could see that there is a lot of stuff. And sometimes for a medical student, it's difficult to get around those administration, and it changes from country to country and even from city to city. And even in the same cities, there's hospitals that are sometimes private, sometimes public. So it's always a little struggle to find out who to talk to. So of course, I cannot tell you in your specific hospital who to talk to, but there's some committee that you could go ask for help to bring this hospital a greener place. So first, there's always the administration board. Depending on the hospitals, they're like the big guns, the ones who takes all of the decisions. As you might know, all of those person. Excuse me. Okay, yeah. Okay, so all of those person are really busy. They are taking all of the financial and political decision in the hospital. So if you go, I let you a little graph here, so you can manage the power and the interest of those people. So for an administration board, you can easily think that they would be like having a lot of power. They have all of the money, they have all of the people working with them, but they might not have all of the interest because they have a lot of other things to think about. So if you go talk to them, you have to be very brief and to put your point in very keynotes to make sure they really understand what you're saying, such like a TED talk or something very, very short, so you are sure that you won't get bored by your presentation. Another thing that you can do in your hospital that it is really important, you can start a green committee. Often it's the youth that start those committees. You know, sometimes we're a little bit more informed about climate change and green hospitals. So you can always start that green committee. Go talk to special leaders. We always know people who can make change in the hospital. So spot them, go talk to them and say, oh, maybe we could start an eco-friendly committee. You know, maybe in the cafeteria, do some vegetarian meals, just as what Catalina told us. So you can do all of those activities by creating a committee with multidisciplinary one, with nurses, with administrative people, with doctors, with medical students. And so those on the graph would be maybe less power, but a lot of interest. So you could keep them informed and trying to make some changes. And when you'll be a resident or when you'll be doing some rounds in the hospitals, when you'll be more advanced in your medical curriculum, you could also go see your medical department. So if I am, for example, in cardiology, there's always some meetings with all of the cardiologists and with the nurses. So there could also be a place to start asking questions, so keynote questions, so they could see, oh yeah, maybe we could lower that thing. And so, oh yes, we could. And just starting the discussion always help. Those people often have not as much power as the administrative board, but in their unit, they have a lot of power. So you can go see them. And if you want to have a little bit more of insight and the data on what are your region doing on climate change, you can always go see your public health offices. They are really involved and their role is to know everything. So if you go see them and ask them for information, usually they're very happy to send it and give it to you. So those are some of the committees or structure that you can go see to make sure that your activity is on point and that it has an impact. But how do we make an activity? That's the important thing. So I'm sure you have all heard about the SMART objectives, but they are really the core of making an activity. I won't get too much into details, but you have them in my PowerPoint and I will share it to you after that. So it's really to be specific. So having really a problem you want to do or something that you want to change and focusing on that. You don't want to make your hospital carbon neutral in 1 year. That's not specific enough and it won't work. But if you have some really specific goals, you will be able to change little bit things, and after a long time it will make a very big difference. So for example, in Quebec, in my small town in Saguenay, in the woods, what we do is that they plan to do a local agricultural thing that would sell local food to all of the hospitals and all of the schools in the city. So that's really interesting for everything that is regarding food security, but also environment, because it's only local food and there is little to no transport for that food. So it's really specific. The problem was that we didn't have enough local food in the city. It's measurable, so we can see how many schools and how many hospitals we can give food to. It's actionable because you can see, oh, is it changing the behavior of the people who are doing the food in the hospital? Do they think a little bit more about buying local? And is it relevant? Of course it is in that point, because in Saguenay it's like not isolated but close to it, so it's really something important to have local food security. And in the time bound, they like, we won't do it tomorrow, we need, for example, to let time for the vegetables to grow and stuff like that. So they have, okay, we're going to do it in 3 years from now. So first year will be we're starting to make some plans, we're starting to make some committees. Second year, we're trying from some small places to have to start a project. And after the third year, it's going to be all around the city with all of the schools, for example. So that's an example of a SMART goal that is really, really relevant and that is really specific, and it's really important, and it will help the system be greener and all of the city too. So that's kind of the activity you can do. So if you want to have resources, IFMSA has a lot of resources for planning activities and planning projects. I will share the resources with you, but we have a manual called From Idea to Impact, which is to help you make an activity. And it's not too long to read, and it's really, really interesting, I promise you. Something else, you have the evaluation of your activity, which is very important. If you want to convince someone, you need to have some numbers, to have some statistics. So it's really essential to know, to plan in advance the evaluation. So if, for example, if you want to cut the paper in your hospitals, you have to know how many paper there was before, what you're going to do, and to see how many papers there are after. So it's really important, so you can, after that, go see the administration and say, my thing worked and it saved us money. So that's something that is really, really essential. And as Omnia told us just a few minutes ago, there's a lot of IFMSA training manuals. There's the one on climate change and health, but if you want any other resources, you can always contact me also. So in your community, there's also a way to make an impact on climate change and on health hospitals. Those are some examples that were held in Quebec. So there's a big regroupment of health professionals called La Planète s'invite en santé, which doesn't translate very well in English. It would be like the planet invite itself in health. It's weird, but it's really worth it. So it's medical students, nurses, doctors, nutritionists, and everything who are together and who are doing some things in local green committees and who are doing some advocacy in the government. There was the march on the 27th of September, the big strike. They were all on the street for that. And we also do a lot of political advocacy with those movements. So like last year, we did 2 press conferences as medical students on climate change. And we went to see local MPs, and it worked. So we have seen changes and we've been heard. So just as Omnia told you, it's a great way if you have a project to make it public and to make it mediatic. So people will know that the medical students are involved and that this is a topic that has an impact on the climate change. So that's it in your committee. And if you have questions, again, don't forget. And so since I am a program coordinator, I have to tell you about IFMSA programs. If you don't know IFMSA programs, it's a big database with all of the activities around the world. We have, I am in charge of the one on environment and health. That's why I'm here. So those programs, it's really the view that it existed because of our activity coordinators all around the world. We need you. The bigger our database is, the biggest impact we have as a IFMSA. So every activity counts. If you have one, just I will join you at the environment fund and the information about programs, but it's a very great way to have an impact. And just to let you know, with the activities that were done in the past terms, me and Omnia, we did a big database, and we will show them to the COP25, to the government. So it has a real impact. So it's not just filling a form, it's also about making a point when we're doing some advocacy. So I would love to have a lot of activities after this webinar. So if you want to contact me, it's environmenthealth at ifmsa.org. I will add it in my description when I will share the PowerPoint. And that would be it for me. So don't forget, it's possible to make things concrete, and it's possible to make a change as soon as we believe it. So that would be it for me.
Wow, thank you to all of our speakers, Cyril, Catalina, Omnia, and Roxanne. It was amazing. Your speeches were really great, and I'm sure it will make an impact. So thank you, everybody who listened to this webinar. We hope it was useful for you all. We also want to thank everybody who helped creating this webinar here in IFMSA-Québec and in NMOs from all over the world. And we will share all of the PowerPoints on the webinar, the Facebook page event. And so that would be it for now.
Yes, thank you.
Thank you all once again.
Bye.
Have a good day.